my name is Tim Reha here at Informed Health 2015 in beautiful San Francisco. It literally seems like the world of healthcare is in town. So we've got Douglas Berman, who's the Deputy Director of Academic Research here at UCSF. How are you doing?
Oh, great to be here. Wonderful day. Amazing outcome and turnout, and just great to see people.
It's been going on since, we've been here since like 7, 8 this morning. So I got Stephen Chan, who's our left-hand big hitter doing social media, and welcome back. We were at CS just last week.
Yeah, it was fun. We had an awesome time there, and we were doing a lot of work here today too, uploading photos to Flickr, doing a lot of Twitter cards too, and just engaging the audience. It was fun.
So we should say thanks to Einor, the sponsors, and everybody who, first of all, made this happen. Oftentimes these conferences are, most of the time, especially within universities, it's built with a small team, and you guys really wanted to drive the needle forward and do some new things. So how did it all get started?
Well, it started with the Center for Digital Health Innovation looking to bring together the Samsung folks and give some visibility to the work they've been doing and the validation work with the Samsung platform and the things that we're starting to see the Samsung platform build into, and really just trying to feature that as a very exciting place where we're seeing a lot of innovation happening.
So we're going to start with a little recap and take some of the Twitter cards that Stephen here was helping spearhead, and then the staff with UCSF, and give you guys kind of a run through of the event. And we're totally freestyle live, so let's rock this. Are you ready to go?
Let's do it. Let's go. Okay. Yes.
So Stephen, we're going to go with actually Douglas, you're going to take point 1, and we're going to go to, let me get this flipped out. So we had Sam.
Talking about the capabilities that we're building here at UCSF, very exciting to see our leadership in front of this and really driving us forward to see that we can move into the future, building these exciting technologies and making a real impact on the way people are able to receive healthcare. So
there were some huge announcements, and like tectonic plates were moving in digital health here. So what happened, and who do we have in this photo?
Well, it's very exciting. Atul Boot is coming to UC San Francisco. Will be starting around April. Very exciting to have him here. He's really been a tremendous leader in the informatics space and in the ability to build digital health. We're really exciting to have him coming, and just know that he's going to have a huge impact on the things that we're able to do, the partnerships that we're building, and it's a game changer for us.
It's a game changer, and that's a special announcement. So welcome to the UCSF family, and we will learn more as that relationship develops.
Sounds good. And then I think we have some other cards that are coming up too.
So next up is...
Well, Warren Kibe, he actually said that the future is learning systems that connect everyone and enable learning from every cancer patient. And he's the director of the biomedical informatics at the National Cancer Institute. And he was talking about how we can basically look at all these cancer patients' information and try to come up with better treatments and better sort of like ways to do predictions to see whether things will metastasize or cells will turn into cancer. Yeah.
And Warren's been huge in promoting the use of data to really understand what goes on with disease, look at how to bring data together among institutions and among different sources and make it consistent and usable. Tremendous challenges in that space. I think the exciting thing that Warren's really pushing is that we recognize that we have all this data, but to make it useful really is where the game is.
Yeah, that's an ongoing thing that I've seen since the International Consumer Electronics Show last week and all these other events, Exponential Medicine. And then it's really cool to see gadgets. Everybody loves gadgets, but these aren't gadgets. These are almost like the future coming to us today. So Samsung and UCSF made some announcements and are doing some cool new things.
Well, I think that the really exciting partnership between Samsung and UCSF is that we're at UCSF helping Samsung actually take these gadgets and turn them into medical devices, recognizing that what their place in medicine is. It's been a long time that we've been able to start to measure these things, but to really understand how it can affect clinical care and to validate them as platforms that are meaningful clinically is the place where I think we're going to see this getting traction as really a technology that's going to move healthcare forward.
And it's an open source platform.
Yeah, so the platform itself is actually something that researchers can get access to. It's something that is not commercially available. It's called SimBand, and they also have SAMI. So SimBand, which is just something you just saw on the screen, it has galvanic skin response sensors, an EKG on board, can measure pulse ox, heart rate, usually the standard stuff, but actually extra things too. Yeah. So you can actually get that at voiceofthebody.io.
And they have the cloud.
And then they have the cloud, and actually there's a quote on that, I believe, that blue one there. He actually talks about how we need to send the data upstairs to the cloud. One of the problems with all these devices, when he talks about communication downstairs, is that all these devices don't really talk to each other very well. You have to take into account the range between these devices, whether they're interfering with each other, whether if you take them to another room, can they still communicate? But not just that, but also the standards and interoperability. So that's a big issue. So his proposal is to send the data to the cloud and let the cloud handle all those transactions.
Well, as well as having a place where it can be communicated and can be brought into the care environment and into the places where it can really start to inform us as individual consumers using the data and help us understand what our health is and to manage our health better.
Yeah, it seems like an ongoing stream of data coming from me. It could be my car, it could be my home, it could be my toilet. All of these things coming together. Hey, don't laugh. Japan has advanced toilet technology.
Internet of things, Internet of everything. So
you track what's coming in, you can track what's going out.
So what's really special is we had Samsung's top brass here. We had Luke Julie is the VP of Innovation from Samsung here, as well as I mean, Ram Fish is just mind-blowing at his presentation on stage. He's the VP of mHealth at Samsung, and you can check them out at Samsung SSIC. Do you guys want to add anything on that topic?
So what's fascinating is that Michael Bloom, who's a professor of medicine or professor at UCSF, was commenting on this because he helped, I believe he helped moderate this panel, and he was saying that, you know, this actually is a good opportunity. All this real-time data that's coming in is a way to see if we can actually re-engineer our standard clinical processes, and so there's a big opportunity for that.
Well, if you look at something like blood pressure, the history of the last 150 years of taking blood pressures really goes to a doctor doing it in his office or doing it in the hospital. To suddenly move and to be able to do that real time and know where it's going every moment during a day is a new way of getting this data. It's a new way of using it. And we're just beginning to evolve our understanding of what that means to a patient and what that means to their care.
And I got to say, you know, I'm as a resident physician, I'm at UC Davis, and I'm studying, you know, I've been through psychiatry. I am actually doing psychiatry right now, neurology, rotations, pediatrics, internal medicine, all those rotations. The challenge is all this real-time data is coming in. How do we, as physicians, take care of that? And because we're not trained to assimilate that.
And the science is just being developed right now, and I think that's really what the important piece of the work that UCSF is doing with Samsung is to actually try and build the science around this and do the necessary validation that turns this cool information into something that really can drive to how people take care of themselves and how the healthcare system serves people. This is Michael Groper, and he's been doing work with the ICU and seeing how we monitor patients in the ICU. The ICUs are very chaotic environments. There's a lot of complicated things that are going on. There's a lot that you need to pay attention to. Using the technology that he's been developing, he's able to better monitor and better keep an eye on what the key things are that help people get out of these very dire environments.
You know, you're talking about, Douglas, all these systems coming together and trying to talk with each other. He had a really interesting slide that showed an ICU, typical ICU room. All these devices, they don't talk to each other, and he also said that, you know, a lot of times the clinicians are spending way too much time, more than 50% of the time, in front of a computer documenting.
Yeah, that's all the paperwork.
All about the paperwork, document. And so he said that he wants to bring in families, he wants to bring in humanize the patient more by, you know, asking them questions about their social lives, about, you know, who they are as a person, through tablet computers, asking them questions about that, and not just that, but also having these dashboards with like almost like traffic lights, and it's like
Glanceable interfaces.
exactly these dashboards. We assess delirium, for example, under the psychiatry psychosomatics medicine service, and it can show you all the different factors, like did they get enough sleep, did they get pain medicine, what could be causing their delirium. Yeah.
So you guys having fun? This is like a one-take exercise, and so there's going to be a couple little boo-boos in there, but we're just here to get it in and out the door. Douglas?
Yeah, this is great.
Let's go to the next slide. You guys ready to go to the next slide? So here we go.
Adam Ghazali, he's the professor of neurology, physiology, and psychiatry, but he's absolutely fascinating. He had a game called Neuroracer, and what it does is it tests your cognitive abilities, not just tests in terms of diagnosis, but it also can help in terms of the intervention. It actually can boost your cognitive abilities and improve them over time. And he actually found that after 6 months, those changes stay the same. Yeah.
Yeah, and humans have expanded our lifespan, but now we need to expand our brain span.
That's right, and the Neuroracer was one product that he talked about, or one tool that he talked about, and the way he's developing other tools, other sort of gamification of ways to enhance your cognitive functions. He was talking about sort of a neural CrossFit, which I thought was a really
that was cool.
a great way to think about it.
Yeah.
Thinking about relaxation, thinking about rhythm. He had a tour of Mickey Hart's brain, which I thought was a really unique place to go today.
And you know what was fascinating though? He has 4 games in development right now over the past 18 months. He's been working on that with his team, and he has partnerships with LucasArts, Zynga, and also the Grateful Dead, I believe, as well.
I believe he's working with
meditation.
The Spirit Rock up in Marin.
So a lot of very cool partnerships.
Very diverse that really look at where brain science is going.
All right, my arm is. I need to work that out. So we're going to go to the next one here, and we are now into Alvin. I really liked Alvin. I had a good time with Alvin.
You know, I've been working with Alvin quite a bit over the last 6 months, a year, and Alvin is a really unique individual. He is a clinician who seems to be a great doctor, but also understands what's going on in the electronic medical record because he really lives in it, knows where the data is coming from, knows where the data is good, knows where it's not good. Now, when you work with people that are doing data analysis, often people will come up with models to understand how things are going to work. Now, Alvin can come up with an ideal model and then know that he can't do that model because the data is not going to be good enough.
Yeah.
And know that a less good model with better data is going to get him better results and better outcomes than the perfect model with lousy data. And Alvin's is absolutely a rock star.
And Alvin, you know, he's not just all about the money is my takeaway. He went to college with Harvard, and people went to Wall Street to do their living.
Oh, yeah.
So, but you know some other facts of what he was doing in terms of getting himself trained to be able to tap the EMR records.
Yeah, so he was actually drawing a lot of concepts from data science. He was looking at Bayesian analyses and machine learning algorithms as well to capture all this data. But what was fascinating was that he said that he was one of 2 physicians, two faculty members at UCSF who actually has direct data access to the EMR. He says that it's a process. He has to go to Wisconsin, to Epic, to get trained for 14 days, take a 5-hour examination, then apply for database access. And I just think it actually underscores that EMRs, just in general, need to have better boosted access. This is not just just EMRs in general, just because they're such complex systems.
Well, the fact that they're complex systems is why there's been a tendency to restrict the data, to make sure that you need the kind of skills that Alan's gotten to really understand what the data means, to know that that measurement taken in that place at that time is one that you can make inferences about, because if you make the wrong inferences, the science won't stand up. And that's where the really hard part is. Patient protection, protecting patients' privacy, the security of it, all bakes into that. And that's what has made institutions want to really protect the data and protect the patients. But in the long run, we're looking for ways, and we're developing ways to de-identify the data and make that available to people. And we talked about that today some. There are de-identified versions of the EHR data that anyone can get to, and we're really building out ways to do that. We're building out other systems that simplify the data that's available to doctors and physicians, and we're trying to make it easier for people to get the kind of access that Alan's been able to build for himself. But he's also done some really exciting work looking at things like how we're using blood in the hospital.
Yeah, he had the method of which people communicate, email, phone, or whatnot, is actually a trigger for the level of their seriousness of their ailment.
Yeah, and that he's been able to really make some practice changes here that have really saved money and improved patient care at the same time.
Okay, let's go to the next one. Where are we at? Are we here? We're here. Okay, we're here. So we have Thomas Goetz. Thomas you might recognize from Wired Magazine. I used to read him all the time, and he's coming in from a little bit different angle than a lot of entrepreneurs. Well, he kind of paired up with his co-founder.
Yeah, and he actually presented something that was very intriguing. He said that as far as there's precision medicine, which is what UCSF was emphasizing today, and there's also personal medicine. And he was saying in the quote, it's messy, there's a lot of things, but what is fascinating is that we've got data coming from genomics, lab data as well. We also have the experience, which is in the EMR, what we physicians enter in. What he's adding to this piece of the puzzle is the patient's satisfaction and experience with medications, and then mapping it out, showing the side effects over time for every single medicine, and also letting you compare with by age and by gender. It was absolutely fascinating.
And I thought it was a lot of fun that he's actually pulling the models for the comparison software from the way people compare cars to each other, and the way people
Netflix.
the way people buy other consumer products, and to really use the experience that computing as an industry has learned to help people make decisions, to help people make these important healthcare decisions.
Yeah, and a lot of the trends are, I worked with IDG International Data Group on consumerization of IT in the enterprise, and now what I see is basic consumerization of medical care where the actual customers, the patient, not the CTO.
Well, there's a lot of similarities, and
I mean CFO.
Yeah. There's a lot of similarities between the way people buy anything and the way they get health care, and that providing information really is what today was all about.
And now we have, I have the brand new Samsung Note 4, which has multiple sensors, and this is connected up to a supercomputer in the sky, tied to your new types of hospital rooms, so it could have my music preferences that show up in my family photos.
Yeah, and it was, it actually brings us to the last orange card right here. Seth Boxer, he's a pediatrician and professor at UCSF. He's also the medical director for IT, and he was presenting amazing UCSF Mission Bay campus that's opening in February, right?
Very exciting. We've got a new hospital opening here in just a few weeks, and the way we've designed the hospital really is to look at how we can use technology to make it a comfortable place. It's a hospital for children, for women, and for cancer. And these being very family-oriented places, we really, what Seth showed us was the technologies that have gone in to create a room that really is patient-centered, that really makes it the patient's room and makes it a place where a patient can be healing, dealing with the trauma of being in the hospital, but also bringing technology to make that as comfortable an interaction as possible, to look at how people are getting entertainment, how they're getting food, how they're...
Education, too, in the room. It's like...
That you're able to deliver videos directly to the patients, that the patients are able to order their meals and choose the meals they want. They're able to choose the environments. They're able to put pictures up that are meaningful to them.
Those are the 3 E's. You got 2 of the E's. I think you had 3 E's. They educate, the systems inside that are built into the patient rooms will educate the patients with videos, entertain them, with a Facebook integration, and also
engage them in their care. And so there are connections that are built that will allow patients to see when their doctors are rounding, when they're procedures are scheduled, to sort of give them more sense of they know what's going on and they're a part of their care. Bringing patients into care and bringing families into care is something that really improves the experience that people will have in a hospital.
At the end of the day, this is going to be a care path to your family, whether they're in your town or 1,000 miles away in Hawaii.
And to create a hospital that has that integrated and that has the infrastructure to support that, and that's thought that through as a big piece of the way care is going to be provided in the future, is the innovation that I think that this new hospital really brings to us, and that really is how the theme of informed care goes into the hospital of the future.
So you guys are opening up this new hospital of the future in 2 months, or in February?
February 1st.
That's only a month away. I'm like going, like, what day is it?
It's about 2.5 weeks. It's really exciting.
When can we check in?
I hope you don't have to, but
That was the ongoing joke, is like the one guy on stage was saying, like, it's a nice looking facility.
yeah, one of the questions was, how are you sure that people will check out once they check in? Because it's going to be such a lovely place. But I don't think people will want to stay longer than they need to.
So, Einar, we want to say thanks to you. We're waiting for her to come back. She's basically running tours. There's a networking party downstairs. Again, I mean, this was just an amazing event. Stephen, thank you for your time.
Thank you. Shout out to our research PI team at UC Davis, Peter Yelleys. We're doing telepsychiatry stuff there. Thank you so much for having us, too.
Thank you for having me. This was great. What a wonderful day. It was a lot of fun just to be here. Lots of people. I think we had over 600 people registered for the event, and a lot of folks through the day.
Yeah, I appreciate being flown down here from Seattle, fresh from Vegas, and I guess we'll check out there. You guys can, find all the information. Look up ucsf.edu and get down here.
And if you want to follow the rest of the conference, hashtags, the history, hashtag is Informed Health 2015. So hash Informed Health 2015.
All right, well, that's a wrap. Thanks for checking out the show. And
how can they contact you, Tim?
Yeah, check me out at Tim Reha, TIMREHA. I appreciate being here, and I had a good time. And it's all about having a good time and really meeting the leading edge of people making a difference. That's centered not about the technology; it's about making people feel better.
It's an amazing place. We've got some really smart people here doing cool stuff.
So that's a wrap. Spread the word, and do check out UCSF. Thank you.